Good afternoon. Welcome to News Hour live on GBC News, your news and governance channel. We are also live on GTV and streaming on Facebook at Ghana Broadcasting Corporation. My name is Micheline Taka. You're welcome. The President, Nana Akufo-Addo, says in his second term in office, there will be massive development in the road sector countrywide. At the inauguration of the Business Resource Center at Tumo in the Sisala East Municipality of the Upper West region on day one of his visit, President Akufo-Addo said the government plans to asphalt 1,500 kilometers of road to improve on transportation on goods and services. For the President, his visit to the municipality is to thank the people of the Sisala East for voting en masse for him and the parliamentary candidate of the area, Mr. Hamidou Issahaku Chinia, in the 2020 general election. He said it also afforded him the opportunity to touch base with the people, to listen to their concerns, as well as hand over completed projects. In this regard, the President has handed over a business resource center to facilitate access to business information and promotion in the area. On behalf of the Paramount Chief of Tumo, Kworo Richard Babinin Canton, Mr. Mohammed Canton commended the government for the numerous development projects the municipality has benefited from in the last. The Initiators of Change Foundation has conferred on the Vice President Dr. Mahamudu Bawumia Africa's Digital Revolutionary Leader of the Decade. This recognizes his digitization agenda to transform Ghana's economy.
His assumption to the office of Vice President, Dr. Mahamudu Bawumia has rolled out a number of initiatives in the country's digital space to formalize the economy, improve service delivery, and to reduce the turnaround time of doing business. On the list are the paperless port, the National Digital Property Addressing System, mobile money interoperability, the zipline door of the Driver and Vehicle Licensing Authority DVLA, online ECG power purchase platform, the universal QR code, digitization of records at the birth and death registry, amongst others. To the executives of the Initiators of Change Foundation, building such soft infrastructure holds the key to transforming Ghana's economy, and whoever leads the charge must be recognized. Mr. Kofi Jan is the executive director of the foundation.
The Initiators of Change Foundation, we want to humbly honor you as Africa's digital revolutionary leader of the decade in recognition and appreciation of the positive impact that you have made on society and the development of Ghana.
The Vice President, Dr. Mahamudu Bawumia, was grateful for the recognition and promised unflinching support to President Akufo-Addo to implement his Ghana Beyond Aid agenda.
We are being guided by the vision and the direction of His Excellency the President, Nana Akufo-Addo. And he wanted us to try to transform the country in a way that we will modernize it, but more importantly, reduce the burden on the poor and the vulnerable, who are largely excluded from society. And this is why we thought that digitization and the digital revolution in Ghana would be one of the key ways of helping the poor and including them.
The Initiators of Change Foundation is an organization focused on governance, poverty reduction.
You're watching News Hour. We'll go for a quick break. We'll be back shortly. Please do stay. 1.26 million doses of the AstraZeneca COVID-19 vaccines. Out of the number, over 300,000 have received the full dose of the vaccine in the second round of the vaccination exercise, with about 375,000 people waiting for their second shot. To speak to the issue, we are joined on the line by the manager of the expanded program on immunization of the Ghana Health Service, Dr. Kwame Amponsah-Chiano. Hello, good afternoon, sir.
Good afternoon, madam.
Thank you so much for joining us this afternoon.
Thank you for having me.
Are we certain of the timelines yet, or we are still in the hang?
I would say that we probably would be comfortable saying that we should be expecting, because we had all indications that we had allocation and that it was on its way until we got information that the manufacturers would have to determine when we receive this. So it's still very difficult to tell exactly. But as for the fact that we have had the allocation, that is 100% accurate. We have allocation for 1.2, almost 1.3 billion. It's around 1.26.
But what assurances are we getting from the manufacturer? What promises have they made?
No, we don't speak with the manufacturers directly. This is coming courtesy of the COVAX facility. We also understand that it was through the U.S. government, but of course we deal more with the COVAX facility. So there are two ways that the COVAX facility gets vaccines. They do it directly with manufacturers. They also get donations through from the giants in terms of vaccine manufacturing countries. So for this one, we understand that it's coming from the U.S.
Very well said. But we are expecting 1.2 million doses of the vaccine. Are they enough to vaccinate the numbers waiting to be vaccinated?
No, this is a different vaccine. Remember, this is not AstraZeneca, it's Pfizer. And for those that have received AstraZeneca, they will get second dose straight away.
But WHO says we can do a cross-vaccination, but...
Well, it is not a policy yet. You probably have cited some documentations in terms of publications, but it's not yet a policy. So we are sticking to the old policy until we have a policy change.
Can those who have taken the first dose, well, you've answered my questions already, and are those waiting for the second dose still protected from the virus, or their immunity is declining by the day while they wait?
Yes, so for those that have had the first dose of AstraZeneca, we also are taking delivery of AstraZeneca next month, and that would go for the second doses. So for that, we are also very sure. Except that normally timelines, you only communicate timelines when you have the bill of lading and so on. And so we don't have those documents yet, but the allocations have been confirmed. Next month, we are taking stock of AstraZeneca.
Thank you very much, sir, for your time. I have been speaking with the manager of the expanded program on immunization of the Ghana Health Service, Dr. Kwame Amponsah-Chiano, who says the timelines are not certain, but certainly we will receive the 1.2 million doses of the Pfizer COVID-19 vaccines. The ranking member of the Parliamentary Select Committee on Health, Dr. Kwame Akando, has asked government to speak out on its plans to ensure the continuation of the mass vaccination exercise. Mr. Akando says the current confirmed cases of COVID-19 is alarming. Health experts say with a steady rise in coronavirus cases, it is only vaccination that can stem the tide. Between 4th of July and 12th of July this year, Ghana's day cases have moved from 250 to 455.
I speak to you now. We had about 1 year to prepare, to procure and deploy vaccination doses of vaccines. And as I speak to you, we have vaccinated around 1 million people. So the answer should be vaccination, vaccination, vaccination. As I stand here as a ranking member on Parliamentary Select Committee on Health, if you ask me when we are going to roll out the next vaccination plan, the answer is I don't know. I don't know. And the worst of it all is that we have stopped doing testing. Now, if you have a positive case, it takes you, the patient, to go and test your relatives. There's no government plan for testing. Now, laboratories are charging between 360 Ghana cedis to 600 Ghana cedis. Now, government facilities have run out of reagents even to do testing. Now, hospitals are full up, and you know. So, the earlier we take decisions in order to save the good people of this country, the better it will be for all of us. Nobody should come and tell us it's an emergency situation. The lack of preparedness of government cannot be misconstrued to be emergency. And so we want to caution the public to practice the social distancing, the washing of hands, the boosting of their immune system, so that even if you contract the virus, you will not be struck down.
Still on COVID-19. As of July 9, Ghana had recorded 23 severe cases of COVID-19 with 11 patients in critical conditions. So far, active cases have moved from 1,849 to 2,314 cases out of the 97,728 confirmed cases. In view of this, the Ghana Medical Association, GMA, is warning that intensive care units in Accra's major hospitals are being overstretched as the country deals with a surge in COVID-19 cases. The experts say the country's hospitals are not equipped well enough to handle the fast rising cases as the nation inches closer to a possible third wave. We have on the line the Ghana Secretary, the General Secretary of the Ghana Medical Association, Dr. Justice Youngson. Hello, good afternoon, sir.
Good afternoon.
We thank you for your time.
You're most welcome. And it's a pleasure being on your program.
Would you say Ghana has the ability to handle severe and critical cases in terms of ICU spaces and general hospital facilities?
Well, the answer is yes and no. We have the human resource to a certain level. In terms of capacity, we have, but in terms of the overall numbers, we don't have enough in terms of the human personnel. Then, when it comes to the equipment, we also don't have enough. And that is why you keep hearing that most of the beds or areas where we can take care of severe and critically ill patients seems to be overwhelmed. So that is the picture that we are currently faced with. And if we don't do all we can to break the current chain of transmission, then potentially we could all be overwhelmed.
Very well. Talking about the overwhelming situation you are painting, the GMA is raising the red flag that the country is nearing a possible third wave with the rising cases. How did we get here?
Well, I think this is something that can be seen as a collective disregard for the protocols. We haven't been able to vaccinate enough, so we cannot start talking about herd immunity. So our biggest option that was available to us was to keep enforcing the protocols such that we all adhere strictly to them. Unfortunately, when it comes to enforcement, you and I can agree that not enough has been done in that direction. And then as a people, we have all gone to sleep. We have a total disregard for all the protocols from the highest level you can think of to the very last person. And this is where we seem to have lost the plot. But all is not lost in the sense that we still have an opportunity to go back to do what is right and break the current chain of transmission. Unfortunately, the new variant that we have in the system of the virus, I mean the Delta virus, this is one that is highly virulent and highly transmissible. It is such that within a short period, given the opportunity, it will infect other people. And then when it comes to the disease burden, after you have been infected, it tends to also bring about a lot more severe and critical cases. And this is one area that our health system is not really sophisticated enough to handle when it comes to severe and critically ill patients. We don't have enough of ICUs and what have you. Then there's also the component where this Delta variant is one that for some reason has affinity for the younger population as well. The previous wave we had, a lot of the talk had to do with the elderly, those with underlying conditions. Kids generally, or children, were not really in the picture that much. But the Delta variant actually affects children a lot more. And a typical example is what is happening on the Achimota School campus now. So we need to be very careful at this one.
We are all stakeholders, but if there be a possible third wave, what is the Ghana Medical Association going to do?
Well, unfortunately, as a professional body, we are limited in terms of how much we can do. A lot depends on us when it comes to our abilities to manage the patient, and that will be communicated to. But mind you, our members are already stretched. They are already fatigued from the previous waves that we had. Then we also have non-COVID cases to continue to manage. Already the patient-doctor ratio is not any good. I mean, we all know what our situation is. And once COVID comes in, what is going to happen is that non-COVID patient care is also going to be compromised to some extent, as we saw in the first and second wave. So it is not a pleasant thing. And we can only continue to advocate that, look, the general population should be mindful of what is happening. We should take the preventive protocols very serious. We should mask up. We should wash our hands with water and soap. We should continue to use the sanitizers and continue to observe the physical or the social distancing. We should avoid mass gatherings such that we don't end up getting infected. Prevention should be the key option for us at this point. We'll also continue to advise government on some of the things to do. But our limitation is that we don't have the enforcement power. And when it gets to that bit, then the best we can do is to advocate. But if the powers that be do not observe or ensure that the observance of the protocols are being done the way they ought to do, then we are all going to be in for a tough time. God forbid, though.
Indeed, God forbid. Thank you very much, sir. I've been speaking with the General Secretary of the Ghana Medical Association, Dr. Justic Jansen, who says disregard for the COVID-19 safety protocols will be a major contributory factor if there be a third wave of COVID-19. Healthcare delivery in hard-to-reach areas in the northeast region is said to have significantly improved due to drone delivery of medical supplies since the VOPC drone center near Walewale, the northeast region, was established about 1 year ago. Over 30,000 medical consumables have been delivered to more than 300 facilities in its catchment areas. Over 32,000 vaccines have also been delivered, and there are plans to expand its coverage.
Hitherto, flood-prone communities in Northeast, Upper East and some communities in the northern regions were inaccessible. With regards to the delivery of essential medical supplies, those areas were completely cut off in the raining season. Now, that is no longer the situation. Zipline's VOPC Medical Drone Delivery Center is strategically located to deliver essential medical supplies to health facilities within communities such as Sakogu, Fumbisi, Bentri, and all other communities, Muaduri district, popularly known as overseas. These communities could not be accessed during the rainy season because the roads were not motorable. The GH3 distribution zipline drones fly a distance of up to 80 kilometers from the Vopsi distribution center at a speed of 120 kilometers per hour. This curtails the long hours patients had to wait to receive emergency medical supplies and saving lives. After the tour of the facility, the fulfillment operations lead of the center, Mr. Leslie Hilton Blankson, described operations of the center as successful. He said the center has so far made over 30,000 deliveries to more than 300 facilities in its catchment areas. Of the number were 322 blood units. Mr. Hilton Blankson said innovative measures are in place to expand operations of the Zipline Distribution Center.
We serve a wide range of facilities in the Northeast region, which we are located, and we also serve some facilities in the Upper East region. Like I said, so far we've been able to make over 20,000 deliveries, out of which more than 322 blood units have been delivered. And we've also been able to deliver more than 32,000 units of vaccines. Out of these deliveries that we've made, over 2,000 of them are emergency and critical delivery services. And we've been able to save a lot of lives.
The Vice President, Dr. Mahmoud Baumia, in 2019, launched the operations of zipline drone delivery technology in Ghana at Omenako, near Suhum in the eastern region, which led to the start of work on 3 other distribution centers. The project aims at ensuring that essential medical supplies are delivered to hard-to-reach health facilities across the country.
The Ejura Nifahene and representative of the Traditional Council of the Ejura Setreduma Municipal Security Council, Nana Osei Kwejo and Sebie, has tendered in empty bullet shells as evidence of shooting during the disturbances at Ejura to the Committee of Inquiry. Our correspondent Nicholas Osei will join us later in the course of the bulletin to give us more details. A journey of an hour to Kulo now takes 3 hours due to the bad road linking Parambo Sawabo number 1 in the Pru East district of the Bono East region to Ambrumase in Salaga in the Savannah region. Residents are calling on the roads ministry to come to urgently repair the road network in the area to reduce traveling time and increase productivity. Peggy Amadanko has the details.
This is the only major road linking Parambo Sawaba number 1 in the Puru East district of the Bono East region to the Klo enclave of the Salaga municipality in the Savannah region to the rest of the country. The Klo enclave is noted for producing tuber crops, maize and charcoal. The feeder road through Parambo Sawaba number 1 runs through about 4 communities before getting to Abromase, the capital of the Klo enclave. This journey, ideally residents say, takes them about an hour. Unfortunately, it takes about 3 hours due to the bad road, getting worse in the rainy season.
When it rains, you will be surprised that the whole road will be submerged. Sometimes you wouldn't be able to detect as to where to even pass with your vehicle. We are commuting from Abrumasi to number 1. Actually, maybe the car may proceed to Yeji. And then, in fact, we're on the way when suddenly there is something from the shaft. This road has been a problem to us. We are appealing to government seriously that Abrumasi road, or let's say Kolo area road, to be attended to.
Here in the middle of nowhere in the bush, we came across this broken down commercial vehicle. Its occupants have been here for almost an hour and more. The women and children are exhausted from sitting here not knowing their fate. Luck smiled on some of the passengers when a tricycle came their way. Our driver tried to help fix the broken down bus, but was not successful.
If
the road is good, our vehicles will not break down.
Unable to leave them behind, we had to wait for another vehicle from Parambo Sawaba number 1 to convey them. People in the enclave are looking forward to a time when their road will be fixed for safer travels. Peggy Amadonko reporting.
A 24-year-old trader at Dunkwa has been arrested for allegedly stabbing his girlfriend to death. The incident happened at Kwadamwene, a suburb of Dunkwa, on Saturday, July 10, 2021. The father of the deceased, Mr. Christian Akacha, who narrated the incident, said he had a call in the morning and was informed about the death of his daughter, who had gone to visit her boyfriend. The assembly member for Kwadamwene electoral area, Mr. Nathaniel Rekun, confirmed the incident and said the culprit, Daniel J., attempted to kill himself after stabbing his girlfriend to death. Daniel J., currently in police custody, is receiving treatment at the Dunkwa Municipal Hospital. The body of the deceased has been deposited at the Dunkwa Municipal Hospital morgue for autopsy. When we come back, we'll serve you with the business news. Please do stay.